The Volunteer Services Program is designed to assist the Northern Health Region by enhancing patient and resident care through the involvement of individuals and groups in the community. This video accompanies the Northern Health Region's volunteer manual. So, if you're ready to start volunteering for the region, in this video you will learn important points about your upcoming experience. And if you're just exploring volunteer opportunities, you will learn a bit about what is expected. A volunteer is assigned to perform duties that complement and augment the role of paid employees. At no time does a volunteer replace an employee or perform any professional duties normally completed by employees. Your key contacts and support include your mentor, the department manager, and the Volunteer Services Department. You will be assigned a mentor who is an employee for training, guidance, and supervision. Your department manager will be able to provide additional support when required. And the Volunteer Services Department provides volunteer onboarding and volunteer matching services. Let's review what you need to do as a volunteer. Volunteers must sign in and out on the volunteer attendance logs located in the facility. You need to report to your mentor on arrival, when completing your duties, and when leaving. You need to report to your mentor when escorting patients or residents outside the facility, if this is part of your assigned duty. Also accept guidance and direction from your mentor, and seek help from employees in any situation you are unsure of. Always wear your photo identification when volunteering. Photo identification is required to be visible when you're actively volunteering. Please do not wear your volunteer ID badge when coming to our facilities as a visitor or patient. You will be required to return your photo ID when you are no longer volunteering. Ensure you check with your mentor before giving food or drink to any patient or resident. Immediately report accidents, injuries, or a fire. Please notify your mentor if you're not able to come at the expected time. Return all Northern Health Region issued material upon resigning as a volunteer, such as your photo identification. Be reliable, committed, and display a mature attitude. It is important to read and follow all Northern Health Region policies and procedures. And be a Goodwill Ambassador. Be a positive image for the region and volunteer services at all times. Be courteous, pleasant, and cooperative, and have a caring demeanor. Now there are some don'ts that we need to review. Don't transfer patients in any way, and don't attempt to assist patients to or from various rooms unless directed by employees. Please don't go into a patient's room unless assigned to do so. Don't wear perfume or strong scented products. Never read patient charts or files or other confidential information. Please don't distribute religious or political materials to residents or employees unless you have been asked to do so. The Northern Health Region strives to provide an accessible environment for all employees, patients, visitors, and volunteers. As a volunteer, it is very important to know what accessibility is, how to communicate with persons with disabilities, and how to assist people with disabilities. You will be asked to complete an online learning module on accessibility. It is extremely important that when you are sick, have a cold, a cough, a sore throat, or flu-like symptoms, that you stay home. Please notify your mentor that you will not be able to report for shifts until you are well. If you become unwell during a shift, Please notify your mentor that you are leaving. When possible, we do ask that you provide at least 24 hours advance notice when canceling a shift. Employees, patients, and residents do look forward to your assistance in supporting the extras that enhance the region. Please remember that it is difficult to get last-minute replacements. Please notify your mentor at least 2 weeks in advance if you will be away for an extended period of time. We know that weather conditions sometimes prevent volunteers and employees from being able to attend their shifts. When the weather is bad, please call your mentor to indicate your availability. Emergency codes provide a concise means of ensuring employees and volunteers receive a common message, which may signal the need for a response. Please review the emergency codes that you may hear while in our facilities. Your mentor will orientate you to the fire plan for the location you are volunteering in. The Northern Health Region is committed to providing an environment that respects and promotes human rights, personal dignity, health, and safety. As a volunteer, you are expected to conduct yourself respectfully and be respected by all employees, patients, residents, and volunteers. The Northern Health Region is a smoke and vapor-free environment. Volunteers may not provide services while under the influence of alcohol, cannabis products, or illegal drugs. Some over-the-counter or prescription medications can potentially affect your ability to safely perform your duties. Please do not report for duty while under the influence of any drugs or alcohol. Infection prevention and control is critically important in the region. Hand hygiene is the act of cleaning your hands. It is one of the most effective ways of preventing the spread of germs. Hand hygiene can be done 2 different ways, by washing with soap and water, or by using an alcohol-based hand rub or hand sanitizer. Please review the method of proper hand hygiene included in the volunteer manual. Remember, if your hands are visibly dirty, hand washing is the preferred choice. Everyone in the Northern Health Region is bound by the Personal Health Information Act, called FHIA. As a volunteer, you will need to complete a FHIA education package and a quiz. In this education, you will learn about the protection of confidentiality and the privacy of patients' and residents' personal health information. It is important to maintain the confidentiality of regional business as well as the confidentiality of employees, patients, residents, and volunteers. You must honor the oath of confidentiality that you sign. All employees and volunteers share the responsibility to protect patients and residents' personal and medical information. It is absolutely critical that as a volunteer, you do not post anything on social media related to the business of the region or any information about employees, patients, residents, or other volunteers. Posting such information will result in immediate termination as a volunteer. All volunteers must disclose situations where an actual, potential, or perceived conflict of interest arises. Now on to volunteer performance and conduct. When a volunteer is unable to fulfill his or her role or does not follow regional policies or processes, the Volunteer Services Department and program managers will discuss corrective actions for the situation with the volunteer. All corrective actions will be documented. If a volunteer is unable to correct the action, then a review of volunteer service appropriateness will be completed, with the possible outcome of termination. Serious infractions such as theft or abuse will result in immediate termination of a volunteer. Also, repeated no-shows will be reviewed with the possible consequence of termination. Examples of concerns that may lead to a warning include, but are not limited to, rudeness or unprofessional conduct towards employees, patients, residents, volunteers, or the general public, use of abusive, offensive, or obscene language, failure to inform your mentor about an absence or lateness, failure to report personal injury, property damage, or an accident, not following safe work practices, contributing to unsanitary conditions or poor housekeeping, unauthorized use of regional equipment or property, bringing visitors to volunteer shifts without proper permission, not performing work as required, and not working well with others. Now on to appropriate dress. All volunteers must report for volunteer duties dressed appropriately. You must be clean and well-groomed. You must wear your volunteer identification at all times. Your clothing and shoes need to be clean, neat, comfortable, and in good condition with no inappropriate slogans. Your hands and fingernails must be neat and clean. Long hair should be tied back at all times. Mustaches, beards, and sideburns should be neat and well trimmed. It is not appropriate to be wearing short shorts, short shirts that show your midriff, backless sundresses, halter tops, strapless sundresses, and sport attire, and long dangling jewelry, bracelets, and large rings must not be worn. Patients and residents may wish to offer you small gifts as a way of saying thank you. Please do not accept gifts that could be considered a form of payment. If you wish to give a personal gift, please check with your mentor. The Northern Health Region cannot assume responsibility for any personal items that are lost or stolen at regional facilities while you are volunteering. Please do not bring large sums of money or valuables. Whenever possible, your mentor will help make arrangements for you to store personal items in a locked area while you are on your volunteer shift. Patients and residents appreciate the time you have committed to volunteering, and the region also understands personal emergencies occur. However, please limit your cell phone use to emergencies only. Please meet friends and family in public areas, such as reception areas, before or after your volunteer time. Do not invite friends or family members to work or be with you while you are volunteering. All volunteers must be registered with the Northern Health Region. All media inquiries must be responded to by the Northern Health Region's Communications Department. Please notify your mentor immediately if you have been approached to provide media information. Thank you for considering to join or joining our volunteer team. Together, we will achieve our vision of healthy people, healthy North.